idea of it, they're still like very leery about.
Okay, but they're not like white knuckle clinch.
No, not at all. No.
Okay.
No.
Have they gone out of the country?
Nothing other than like cruises or like something
Have you
like
gone
that.
out of the country?
Nothing other than like.
You just got your passport.
I just got my passport. I went to Canada. Like that was.
Okay. Well, that's good to know.
I'm so happy to report that Shannon Keogh is registered on the GSN, so it's working.
Oh, good. Excellent.
Yeah.
Good.
There you go.
So now, Christine, what's your story?
My parents are used to it by now.
Because you went to
I
Ecuador.
went to Ecuador, I've been to Costa Rica, I've been to Italy by myself with my friends. They're kind of just, they know, they're fine.
Okay. Good. Yeah. Jill?
My parents are cool with it. Hi, Jess.
Hmm.
And my mom's like totally about it. You know, I was a little skeptical at first, but she was like, "That's awesome! Like, do what you gotta do." She understands. Again, like that I'm gonna do what I want to do, and she knows that I'm gonna be with safe people and I'm gonna be safe at all times. So my parents are okay with it, and they're encouraging. And yeah, they've been out of the country before. They've gone to Spain, Morocco, Puerto Rico a couple times.
And they're from Cuba?
My grandmother's from Cuba. So
yeah.
they've been everywhere. They understand the risks and know that it's not going to be the best of ideals, but that I'll be with a group that's going to take care of us.
Yeah.
Can I say something real quick?
Sure.
When you get my ticket, it needs to say Anna Christine.
Yes.
Just because,
Your passport.
sometimes, because it needs to be the exact same as the passport. Okay. And I have to go.
Okay.
So,
Awesome.
bye.
And this health stuff is really important, so
Watch the video.
yeah, watch the video and make an appointment with your doctor. I would like to see everybody do that, just because it's a good idea. And if you have your own, you have asthma or you have anything, I just would feel better if everybody had kind of a checkup. When was your last booster shot of tetanus, that kind of thing?
Isn't that like toddler?
Yeah, I think I might have been.
Every 10 years you need a booster.
Yeah.
I got my first one a week ago, or like a month ago.
Your first ever
Tetanus.
tetanus shot?
Well, from being a child.
Really?
Since being a child.
Oh, I
Bye.
love that. We'll see you, Christine. Goodbye, Anna.
Oh, wait. So Kathy, it's your turn.
I haven't told my mom yet.
How's your husband
I don't
liking it?
I asked him if he wanted to come because he's going to retire. He said no. Maybe he'll come. I don't know. On his own. Follow us around in his little rental car.
Of course my parents are worried. But they're getting used to it. They see it that, I guess if the college or the president of the college is going, then it must be safe enough for their daughter. But they're still going to be worried. I'm not going to lie. They're still going to be worried when I'm gone there, but they're not going to, like, pull me away from it.
Okay.
Good.
Yeah.
I need that connection because I just know that when I was in Louisiana for a week, if I didn't talk to my mom every day, she was freaking out.
Yeah, my mom was too.
Exactly, and I just know that being in a whole nother country, I was still in the same country, being in a whole nother country is gonna, she's gonna want to talk to me every day.
But you know what, Jill? She can't.
Can't.
You can't talk to her every day. I mean, maybe that text thing will work, but it's not going to be logistically possible to make sure
in the
that
villages,
happens.
we're not going to have communication.
Okay.
So,
So
think
you're
it's
gonna have
best
to
just to
tell
leave
her
your
that.
cell phones at home
Yeah.
because we probably can't charge them.
Right.
Okay.
Yeah. So I'm sorry, but that's the truth of it. And also maybe you could try some things like we could try maybe on certain
phone
days.
chain.
Yeah, phone chain. That
that's a good
everybody's
idea.
parents will call
That's a really good idea.
Like I think the biggest thing is my mom would want to know that I'm there safe and that I'm leaving safely.
Yeah.
Right.
I mean, as long as she would know those two things, she would understand that I'm there. And I'm there for 6
I like
days,
the idea
but
of a phone chain. I think
Yeah.
that's a great idea.
Okay.
Yeah.
And the other thing is, I mean, I'm just thinking creatively here, like we could make, I'm sure that Margaret Fox Tully, somebody here will want to know that we all, so I could ask her
that's a
to,
good
would
idea.
you please call the other
Right.
Right. I
families?
just,
That's a good idea.
I just don't want it to get down there and have no, not her know that I was there safe or anything. Like.
Right. We will also give you, on the sheet that we'll give you closer to the trip, a contact sheet to get parents. So that, now again, these organizations are not going to want, just
but that's like
chatting.
something to make mom
Emergency.
feel safe.
Yes,
Yeah,
exactly.
It's
Like
there.
there's an emergency.
Right.
Here's where you would call, and you better find a friend who speaks Spanish, or call Dr. Giuliano, because he'll make the call for you. We'll
Joyce.
set up a way that
Yeah,
if there's
Joyce.
an emergency,
That's a good
that we
idea.
have somebody, because many, except for CRS, there's not many English speakers. Well,
Okay.
San Lucas, of course, does too.
No, that's fine. I just
Yeah.
No, that's a good idea. Jill's
Yeah.
mom, yeah,
Yeah.
she speaks
You
Spanish.
could be
right.
the-
So it's just, and I would have to give her like where we're staying. Like she needs
Yeah.
all that information.
Yeah.
Even when I went to
Sure.
Louisiana, like I had to give the number.
But that's a
and
good
everything,
idea.
yeah, no, that is a
Right.
good
No,
idea.
I know.
Okay.
I just don't want another like Natalie Hallowell story or anything.
Oh.
So
Halfway?
We won't
No.
be on the ocean.
No way. Well, as far as the parents, then I'm just going to put it on you as a group, or one of you wants to take responsibility for setting up a parents meeting.
you think that's a good
Parents
idea?
meeting's a great
It's,
idea.
it's up
Sounds
to
like
you.
it would be.
Yeah,
think it has
mean,
to
we
be.
did that with the first. We've done that with each of the CRS interns because that really was.
That's a long commitment.
That's a long
Yeah.
commitment, and they're by themselves. So we've always met with the
Did you do it
parents.
for the Ecuador trip?
No, I've never been the point person on the Ecuador trip, but I've never heard of anybody doing it.
Mm-hmm.
But if you'd like to, I'm more than happy. I know where your parents are coming from. You know.
So like closer to like maybe in January have the parents meeting.
Yeah.
Yeah, but you might want to start the conversation soon so that you're able to find a date, so it's not like 3 days before.
Now, is this the
something like
basic
that.
itinerary? Like, I can give this to my parents?
Well,
I'm sure they'll
the
map it
basic,
out.
yeah. I wrote
Little
tentative
starter.
because I thought I might walk in here and you all say no, we can't leave, we can't be that long. Or I didn't know what you'd say, so I didn't want to.
On the 14th in admissions.
They're not going to understand, Mary.
Yeah, okay. Well, what I'm saying, Brittany, is you will get a much more detailed one that'll have the flight number and the name of the
But
hospital.
it's the 7th
but this
through
is
the 14th.
yes.
But these are definitely the places we're
Yes.
going.
Yes.
Okay.
Right. Now,
We're gonna
might
need a
it get
couple
tweaked a
days
little
to
bit
go
if I learn something different? Possibly, but this is the way it's looking right now.
My
So-
parents know that Dr. Zurich's my adopted father, so
Okay.
they understand that I'll be.
All right. Now let's look at the timeline on the bright orange sheet. I put it on bright
You're
orange
so
on
organized, Mary.
purpose.
This is great.
Well, because I couldn't think how to do the page numbers, so it was easier to do colors. Timeline, November, December. There's no, finalized travel dates. We just did that. And Jess Haggerty, hopefully you're cool with the dates. And to be aware, as you all are, non-refundable. So I consider the dates now set. I'm now ready to call the travel agent. Okay. Copy of the passport. I need those. Discussions, we talked about you talking with essential people. Whoever those people are in your life, just to make sure that is done.
Don't you need a copy of the passport to book the tickets?
Yeah, I actually really do.
Oh.
Yeah.
So, when are you gonna?
It
When
might be like another week.
before
he
it
said,
arrives?
He told me a week and a half.
That's okay.
Okay.
Actually, oil prices are going down. I know I was so quick to buy my tickets for Thanksgiving back when they were high, thinking they were going to get to be
Right.
$5 a gallon,
Got
and now
really
they're
cheap.
$2. Yeah, so much for that. So as soon as you do have it, and if the rest of
You
you
just have to
could,
go home.
Could,
Make
could my
a-
parents fax mine over?
sure,
Do you think?
yeah, and you're going to have to email me because I can't remember our fax
Oh,
number.
you have one?
We do.
Okay,
yeah,
great.
Okay, but you'll want to have multiple copies anyway.
Right.
So, but I want one. Travel health. Yeah, Sue is going to come in a few minutes. Please do talk to your personal physician. And Sue probably won't say this, but you will find that unless you have a globe-trotting doctor, they're not going to know. They're like, oh yeah, Guatemala, da 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 da. How many people come in their office and want that? You're going to know more than your doctor about that.
And then the cdc.gov will tell you everything
Yes.
about that.
Yes. So you'll look at that and assess, with Sue Fitzgerald's help. But then when you make that appointment, tell them, after you've talked with Sue, you should know what you're asking for. You want just a general physical. If you need a renewal of a prescription, or most people get preventive, like they get a batch of antibiotic in case you got a really bad case of diarrhea or something. I mean, I still have mine from El Salvador. I didn't use it, but
Now, what about medicines that we're already on? Is
Well,
it okay if
you-
we can take them?
Oh, sure.
Okay.
Yeah. But you just don't want to realize when you're down there. Oh, I have to
Yeah.
renew my prescription.
I was
You
thinking
just want to be
extra
sure.
week
Okay.
of stuff.
Right.
Well, I just have my anxiety medicine that needs to go with me, so.
Take
Yeah.
yours.
Otherwise, you'll be.
Extra then.
Yeah, that's good. That's good. And that's so critical to do quickly because there are some of those things that take time that you need to, for instance, if you never got one of those hepatitis ones, I forget which one it is, Sue will tell you. You can't, she'll tell you, but you can't do it in one day. So if there's certain, that's why I'm urging you not to wait.
Does she travel?
Who, Sue?
Yeah.
I don't actually know, but she's done this before and she studied the site.
Now I have like, this is stupid, but I have
Yeah.
like special face wash and stuff.
You're gonna
No.
be tired of carrying it.
No, but like, would we bring our own shampoo and own body wash and our own
Bring the
water?
little tiny bottles. Right?
Yeah.
Can I
Yeah.
tell you, like when we were in El Salvador, Mary got the hot shower, we got
Nobody
the cold
else.
we're
I didn't mean to.
gonna get used to each other's smells,
Yeah.
pretty much.
Hey, Sue. We were just talking about health, and we have this wonderful group here that's headed to Guatemala. This isn't everybody. Does everybody know, Sue?
Not to Guatemala, no.
Yeah, and there's actually 3 people who aren't here, Sue. Christine Graff and Jess Haggerty is on this. She's in Spain. She's going in the. They're videotaping it for her, and Dr. George is going.
Okay. Oh, that's
So
great.
now Jess meet Sue Fitzgerald at the Brady College nurse. Is that correct title?
That's sure.
And I asked her to give them a break from listening to me and to hear somebody who knows what they're talking about health matters with going to
Well, when
Guatemala.
I zoom in, so you gotta zoom out.
That's exciting. And I'm glad that you're doing this ahead of time because there are some things, to be honest, I don't worry about our students as much as I worry about our more
Old
seasoned
The
travelers.
mature,
Oh, I
the
love
mature
that.
back
Travelers.
We're getting some pizza, so I want to keep it
Okay.
going. Yeah.
Season. That's what
More
we are.
seasoned travelers.
Like where's the paprika?
How calm it.
Because I'm pretty convinced, especially if they're Cabrini students, that their immunizations are up to date. The only one that might be in question is their tetanus, depending on when their booster was before they started school. But for our more mature, seasoned travelers, you may have some more
I just love it.
more vaccination needs.
I used to like Sue.
I reviewed what the CDC has to say about Guatemala, and I think it's not unlike most countries outside of the U.S. In their recommendations for vaccine. Certainly hepatitis A, and we are actually, some pediatricians are now starting to vaccinate all children. So in about 15 years, I won't even worry about our students for that. But hepatitis A is a vaccine that, like influenza vaccine, takes 2 to 4 weeks to confer immunity. So you want to get that a minimum of 2 weeks before you leave, and then there's a booster due that's 6 to 12 months later. There's a nice window there for when you return home that you get that second shot. And that, they say that immunity lasts anywhere from 5 to 12 years. To me, that's hard to know. Yes.
Wait, I'm confused. So the booster you get with the hepatitis A?
A booster is a second
later.
shot.
6 to 12 months.
But
6
if we
to
just
12
got
months
the
later.
one, if we didn't get it, we would be okay going.
Yes, absolutely. Most of the immunity is conferred after that first dose. Okay.
But it has to be at least 2 weeks before.
They recommend 2 weeks before. I wouldn't not get it if you only had a week to go, because especially for you folks, you're otherwise healthy people with healthy immune systems, so we would expect your immune response to happen sooner rather than later. If you had other health problems that might slow that immune response, you might be looking at the 4-week conferring of immunity. But you guys are otherwise.
After you come back. Okay,
Yes.
I understand. I was really confused.
One
I'm
shot,
sorry.
a minimum of 2 weeks before you leave, and then a second shot 6 to 12 months after that first one.
Okay.
Okay,
Got
that. Hepatitis B, these guys have all been vaccinated, series of 3. It's not recommended for every traveler. It's recommended for travelers who might be, depending on what you're doing there. If you're working in a healthcare facility, certainly hepatitis B would be recommended. If you think you're going to be coming in contact with blood or body fluids, if that's going to be part of your experience, then hepatitis B would certainly be recommended.
Which I've never gotten it in any of my trips.
No.
Yeah. I mean,
How
Yeah.
often
Like, when do you think my last one was?
Your hepatitis B,
Mhm.
you're fine. It's a series of 3. You probably had it at birth. It started when you were born.
Okay.
And that's all we
That's
just
all
give
you
that
need.
one series of 3 given over a 6-month period. And again, even with hepatitis B, most of the immunity is conferred after the first 2 doses. So we do it as dose 1 is at 0, dose 2 is at 1 month, and dose 3 is at 6 months. So if you're considering hepatitis B and you have 4 weeks before you travel, if you've gotten that number 1 and number 2 dose, most of the immunity has been conferred. That 3rd dose acts like a booster. We don't track in the health service for that 3rd dose. We track for the first 2. But again, these guys, that's a requirement. It's a requirement of public school in Pennsylvania now. Back to hepatitis A, that one is, I'm sure, strongly recommended for travel outside of the U.S. The prevention, hepatitis A is traveler's diarrhea. The prevention is don't drink the water, don't eat the ice cubes, bottled water only unless you're boiling it yourself. Avoid uncooked shellfish, uncooked fruits and vegetables that are not peeled or prepared by you. So it's really about food products. That's how you get hepatitis A.
Yeah, and we will, like where we go, we will be staying with people who will serve us bottled water. I mean, it'll be in big
bottles.
And so, but you should brush your teeth with that too.
Yes.
You know, so I actually would wash my face with that. But the sisters and the hosts that we'll have will not. But if we were going through a marketplace, I wouldn't buy the stuff that's there, and not to drink anything out of the tap.
I never asked this question. I never saw an answer. Contact lenses. What do you wear contacts? Don't you? No. Does anybody in here wear contacts?
I would think
Just
just your
me?
solution
Okay.
would be, I wouldn't use tap water.
Oh, that's what I wanted to make sure.
Yeah.
I
Yeah.
don't, but I just want to make sure.
Yeah, I would
Oh,
think, because the
Christina.
bacteria would be.
Christine
wears
and-
glasses too. Haggerty?
And Haggerty might use
I don't
contacts.
remember.
Yeah.
And for traveling purposes now, I'm assuming you're all going to check bags, because you can't.
We're going to
Take
have to
that
check
stuff,
at least
carry on.
one. That,
Mhm.
Yeah.
Mm.
That's what we do when I
Yeah.
travel as a family, because, I have 3 daughters. Not that we have to have an array of shampoo and conditioner and hair products, but we check one bag so that we can fit the things that are greater than 3 ounces. We can bring those with us.
We're going to sleep in a convent one night. They might not even have a shower.
Oh, right.
I think they'll have a shower.
You think?
But the hot water thing, I'll ask them, but, so in terms of like,
We're seasoned.
Yeah.
I mean, lengthy shower. I mean, you're
Yeah.
talking like a 2-minute shower at
Yeah.
these places.
And
Because
you keep your mouth closed.
Right. That's right. You don't want to.
and also when
Let the
you
water
wipe
go in your
yourself, your bottom, they don't put the toilet paper down the toilets. They have like a little trash can.
because
It's septic tank.
their septic, their systems don't have enough capacity.
I remember that in Mexico.
Yeah.
And packing,
Look
even
at
like
my nose.
Purell and hand
Right.
sanitizers, those are usually more than 3 ounces. Or you would certainly want to take a larger bottle, so that could go in
Or
your checked
smaller.
bag. Or lots of little
you can bring
ones,
little
right.
Yeah.
Or I like
That's
the
good.
wipes too, because I don't think I think you can take those even on a carry-on bag.
Yeah.
Yeah, that gets through security.
Mm-hmm.
Okay, so that's hepatitis A, hepatitis B, tetanus. Again, you guys, you'll need to check your records, because if you were like 5 years coming, your tetanus was 5 years old when you started at Cabrini, and you're a junior now, that makes it, 8, 9 years since your last dose, and you would want that to be a current vaccine, because you're going to anticipate getting hurt, and we would booster after 5 years if you got hurt, if you got cut. So you would want your tetanus to be within 5 years. And that's okay. That's
and we
not.
would have you do that even if we were going to the Poconos. I mean,
Yes.
We've had that,
Really?
I had,
Camping.
the only accident
Mhm.
I've ever had at any of the trips was on was in West Virginia. Somebody stepped on a
A nail.
people that went through their cedar.
Mhm.
So,
Was
So
that the
that's-
Addicel one?
That's the new, yes, and they
Yeah.
will probably booster everybody with the new one with acellular pertussis, because I don't know that it's endemic in Guatemala, but it's becoming endemic here. Our whooping cough immunity has kind of worn off. So we're seeing outbreaks in particularly middle schools, if anybody's an education major. of pertussis or whooping cough. So yes, we're vaccinating with a new tetanus that also contains a pertussis. Okay, MMRs. You guys, again, our students are good on MMRs with 2 doses. Anybody born after 1957, though, and before the early 80s, we only got 1 dose. And we have found that that is not enough.
Before 57.
If you're born before 57, you're good for probably measles, mumps, and German measles because you were exposed to disease.
We had them.
Yeah, we did.
It's those of us that, that may not have been exposed, and now our immunity has worn off because there is no measles out there. There was nothing to boost our immunity. So if there's anybody traveling in that age group, they would definitely want to check their measles to see if they ever got that second dose, because that would be important for them.
I'm glad you're checked, because I didn't, is that on the CDC sheet?
Yeah, well, that's considered a routine vaccine.
See, I wouldn't have
But
known
for
that.
adults, it gets kind of funny because people don't remember whether or not they've had
Right.
diseases. And we knew that immunity was wearing off, and that was a newer requirement. Typhoid. Typhoid came up on the CDC's website for Guatemala, but depending on where you're going, if you're hiking into the mountains, then there may be a risk of typhoid. If you're staying in less rural areas, you probably don't need typhoid. But it came up as an optional vaccine.
Yeah, we're not going to really, I'll ask them that, maybe that's another thing.
What is that? I'm sorry.
Yeah, what is typhoid?
Typhoid is another disease you can get. Mosquito bites carry typhoid.
The only trips we've ever gone on that I've recommended it were when there was a lot of physical outdoor work.
Which we
and
won't have.
We won't be doing. So I will check with the San Lucas people. I have a feeling we don't
Okay.
really worry
And
about
that's
that.
1 dose at least 2 weeks
Yeah.
prior to travel. So
ask about typhoid.
and it comes in an oral form, it said, but I've never seen, because the
Yeah,
oral,
I took
just
it.
like the polio, is live vaccine, and we've for these guys, they've gotten away from those oral polios too, because it's live vaccine, and you risk shedding it and exposing people in your community that may not otherwise be able to handle exposure to
Oh, interesting.
those.
So you can end up getting somebody else sick because you're taking the,
Yes, chickenpox is still live vaccine. So
Yeah.
if you have a grandparent who may have had an organ transplant or is immunocompromised or suppressed for some other reason, and their grandchild just got chickenpox vaccine, they shouldn't be around that individual who's immunosuppressed because it's live vaccine and there's a risk of shedding. Yeah, the virus. Malaria, only if you're visiting a risk area in Guatemala, and again, I think that's like really way up in the high country, or
yeah. And that's actually, as much as I understand it, in the real lowlands too. So.
right.
But again,
It's really remote areas.
What we were told in the past was that the main thing to do about malaria is prevent yourself from getting mosquito bites.
Yes.
And I mean, I've been in groups to El Salvador where people did get mosquito bites. I mean, it's not like every mosquito is going
Right.
to. You don't assume I have one mosquito bite, I'm dead. I'm going to get malaria.
It's kinda like
You
ticks
would
and
die from
limes.
it anyway, but it's not every single bite is going to
Right.
cause malaria.
I'd be the one that would pass.
Yeah, no, I know.
Me too,
I thought I
Meg.
better say that.
No, I don't think malaria is.
Jill, should we call for the pizza guy, you think?
I said 5:15, 5:30.
Oh,
What
okay.
time is it?
It's 5:23.
So far, the kids
Are good.
just need
check your tetanus.
tetanus.
A.
And-
Wait, or
And
Hep A, right?
hepatitis.
Hep A, yes, because that was not required for you guys
Oh,
yet.
okay. And okay.
Hep A, and then influenza is always a good thing to get.
No, I just
This
got
time of
mine
year.
like a week ago. Will
That's
I be
fine.
good?
Yeah.
In
Again, you're
February?
otherwise. Yeah, influenza vaccine is good for at least 4 months. So that's why we don't like to start vaccinating too early. We like to cover October, November, December, January, and February. So we don't start till the middle of October to vaccinate
Do you
against
still have
flu.
them at Cabrini?
We still have influenza.
That's
here.
Will
the flu
be
shot,
here
right?
soon.
That's the flu shot.
Okay.
Yeah.
Let's go together.
Yeah.
Wait, what's
Yeah.
influenza?
And
the
the
flu shot.
Flu shot, and that's a worldwide
Jill
thing.
Walker
Somebody
got it.
asked me just this week getting their flu shot if it would cover the flus that they might come in contact with elsewhere. That's a worldwide thing. We track flus as they come across the globe. Yeah.
It's you.
Sorry, that's me. Let me call you right back. Okay, the only other disease of interest that apparently is cropping up, and I think we have a faculty member whose son was traveling and actually came down with dengue fever, which again, a mosquito-borne illness.
Yeah, Brittany is getting a little bit more.
Yes. That's right. Yes.
There's no vaccine against dengue fever.
Yeah.
Usually a mild illness, again, mosquito-borne.
Yes.
So it's all about
Yes.
preventing exposure to mosquitoes. But apparently it's the most common cause of fever in travelers returning from the Caribbean, Central America, and South Central Asia.
Mhm.
So
And there
don't
was
need
just
malaria, because that's the number one question my mom keeps asking.
no, you don't need malaria
So-
based on where you're going in
Okay.
Guatemala. Yeah.
Okay,
Yeah.
cool.
Yeah. But you
Okay.
do need to, be vigilant about not getting mosquito bites, which is the other reason why wearing any kind of shorts is kind of not a
Silly.
great
Yeah.
idea. 'Cause why give them more temptation? Just show them your clothes.
Okay, and what do you need to bring with you? Clearly, if you have prescription medications, you don't want to run out of your prescriptions while you're there, because I can't imagine the challenge it would be to get those refilled. And I recommend bringing extra doses. I have been a camp nurse, and students or campers will come with, and the mom has counted out the exact number of tablets to last that camper 27 days. Well, heaven forbid we drop one in the mud.
Yeah.
So a few extra doses of prescription medication is, I think, a wise choice. Don't forget your over-the-counter medications, particularly if you suffer from allergies. Benadryl is always a great thing to have on hand. Even if you don't suffer from allergies. If you do get bug bites, Benadryl, is great for itch.
Dramamine.
Dramamine for well, you're not on a boat unless
We're gonna
you
be
get
driving a
plane.
We're
lot.
going to be driving.
Oh, right.
I definitely.
But it's
Yeah.
also the plane ride. I can't do plane rides
Yeah.
without Dramamine.
Yeah.
That's
We did do
fine.
a train ride.
And Dramamine is similar to
I took it. We
antihistamine.
took it for train. Yeah.
Dramamine is similar to antihistamine. So if you run out of Dramamine, you can Benadryl is an
Oh,
antihistamine.
great. Okay.
What
So
about
it works the same way.
like Tylenols and stuff?
Absolutely, your
Okay.
Tylenol, your Advil. They'll always, I don't know if you're near pharmacies, they'll always have those things, but they're usually called different things, and you're
Yeah.
never sure,
Yeah.
Yeah.
is this Tylenol, is
Yeah.
this
Yeah.
Now,
Advil?
do you know would we have to put these in the check-in bag?
I
No,
carry them.
yeah, I
Or
would
you-
carry on your medications,
You can
and as
carry
long as
your
they're
allowed
tablets.
pills?
Oh, absolutely.
Oh.
Unless it's a liquid.
Unless it's a
And then-
liquid and greater than 3
But I
ounces.
don't know what you would bring. Pepto-Bismol wouldn't make any sense probably. What do you recommend if somebody does
Antidiarrheal,
get diarrhea?
yeah, Lamodal or
Okay.
Imodium, which are both over the counter.
People swear by
But like, do
Imodium.
They work
come
like
in
a charm
tablets
tablet.
as
Yes.
opposed to
Mhm,
liquid?
and it's
Roll
one
it.
They do.
tablet.
Yeah.
Yeah.
hmm
Okay.
Yeah, Tums, Imodium.
Right.
Imodium or
Imodium is-
Lamodal,
yeah.
they're both over the counter now.
Right.
And then a lot of folks will ask their primaries, your primary care providers, which I'm sure you would take all these questions to anyway. And if that's where you want to go for your vaccines, you should let them know ahead of time. Say, I'm traveling and I need a tetanus booster, because some offices are not stocking vaccines that way. And Hep A in particular, particularly if it's a grown-up doctor. The pediatricians will probably all have Hep A now, but if you go to an internist or family practice, call ahead of time. And if it's something that they don't normally have in the office, they can write you a prescription and you can order it through the pharmacy, your CVS, and go pick it up. And the same with typhoid. They should be able to get, if they don't keep it in their office and you think you need typhoid, let them know ahead of time before your appointment.
Typhoid's the mosquito thing.
Yes.
Right? Okay.
But I will ask, again, these are all, in the end, everybody has to take responsibility for your own health.
Mm-hmm.
So, what you're hearing is from Sue is the recommendation of Community College and the CDC, but there are things that are judgment calls,
Right.
and
I'm sure there are a lot of people that have traveled
Yeah.
to Guatemala with not up-to-date immunizations and have come back just fine.
yeah,
So not everybody that travels to that country is at risk of getting anything.
right,
Diarrhea would probably be the most common
right.
risk.
Exactly, and actually the risk I see most people who don't feel well, it's because they're not drinking enough water.
Enough water. Will it be
Just
hot?
Bottled water, it won't be very hot, not particularly. No, it'll be warm.
Should be beautiful.
But it's just that
87.
your you don't realize that you're sweating, and it's just your water just keeps your body healthy,
Mm-hmm.
and because you're eating foods you're not used
Yes.
to eating, and you know your appetite may be lower a little bit, and it's just good to be drinking water, and not to say, oh, I'm not thirsty, because everybody needs to drink water. We just don't think about it. And there's more. I didn't even offer you. I have water over there.
But not tap water.
Not tap water.
Or
No.
Never tap.
Or ice.
Or
Or
ice.
ice.
So sometimes we
Coke.
might on the trip make sure each day there's a water brigade person whose job it is to be a pain in the neck about saying, all right, we're getting on the van, where's
I'm
the
good at
water?
that.
You want to do that, Jill, to make sure? Okay.
Mhm.
Tara, did you
Did
get
somebody
water?
bring on the big thing of water so we can fill our individual water?
What do we do when you said that we're going to be served? Like, if
Well,
we go
Sue
to
was
dinner?
just saying that when you were reading it, don't eat it unless you yourself prepared it.
Right.
Oh.
Or if you know the people
Yeah,
who have
well, that's,
prepared it.
it will be the second category, because we're only staying with people who are, in a sense, family. I mean, the
Okay.
Cabrini sisters, the San Lucas Mission that deals with hundreds of volunteers all the time. So we won't personally have cooked it or peeled it, but we are only staying with them because we trust them and they know that
I'm
we
gonna go find
need,
some napkins.
that we need things washed. The people who live there, actually, their bodies have acclimated to some of the water, but also many of them do have a higher health risk of coming down with some of these things.
I
So-
think what they're talking about is like street vendors,
Oh,
and I don't
Yeah.
know, farm markets, and eating foods off the street,
Right.
on the street. One of those.
I know what you mean.
Yeah.
Yeah, and even apples and things, I mean, they do say if you get one, only eat, like, it's easier to eat an orange because you have to peel it.
And a banana,
But,
right?
and a banana too has its automatic, you have to peel it before you eat it, but if there's other fruit, it's best
Yes.
if you peel it or if it is peeled, so.
Sunscreen.
Oh,
And,
that's a
yeah,
big one.
that's a big one. And
Those
those are
are
usually
higher
big
up.
bottles, so that's gonna have to go in your checked bag. Bug sprays. Two kinds they recommend. They recommend the one with DEET, like off, that you put on yourself. But then they also recommend being able to like spray where you're staying, the room, like not a yard guard, but something similar to that, where you'd be spraying the room for flying insects. That product is supposed to contain a pyrethroid.
I know I've been on groups where we pre-spray our clothes, and
Right.
that lasts for
Yes.
several washings. And we can find out the
You
name of
can-
that. They sell it actually at the Penn Travel Medicine in Radnor,
Oh, right.
down on King of Prussia
Yes.
and Radnor Street
Mhm.
Road. But I've never.
That's a great
done
idea.
it. I mean, my own concern would be, I don't really want to breathe that stuff.
No, I
Yeah.
wouldn't want to be exposed to that.
So.
Well, how
But
does
that's
that
another-
Malaria, so
Pyrethroid.
we're spraying it.
How do you-
Pyrethroid.
Mhm.
Pyrethroid.
Okay.
As opposed to the DEET, which is what you put on your body.
I am not getting malaria.
No,
I
you're
don't
not-
want anything
you're not-
else.
No.
But not every solution is chemical though. I mean, I see what you're saying, but like when I would be there, I would even though I like to go to bed after I take a shower, and I don't really want to put that stuff on when I'm nice and clean, but I do. I just put it on before I go to sleep. And so, I suppose, I mean, I don't think people use malaria nets down there, but mosquito nets.
Right.
There are places around the world where, actually, Brittany, that's a project you're doing in January, isn't it? Nets for Nets,
Yeah.
which is you're raising money to buy nets for a village in Africa
Oh, wow.
that will help prevent access
Malaria,
by
yeah.
mosquitoes to you. So
Maybe I can borrow one of these notes.
yeah.
They sell them at Dick's Sporting Goods, at the camp, the Poconos, the campers, because some of the sleeping quarters had no windows.
Yeah.
So they would use bug nets
Yeah.
on their bunks.
Put it over your bed. Yeah,
Right.
I'm trying to think how you would do that. I mean, yeah,
We would be very
we
creative, hang them
have
from the
seen
ceiling.
people use those. I wonder how big it is. You can get them, as you say, at a sporting goods.
No, it's my sister if she calls back.
So
I
you
might
could put
wanna-
it over yourself in your bed.
Hello?
And if you're a wild sleeper, good luck.
Right.
What's up?
Oh, you'll wake up and you'll be tangled in this stuff, and then
Right.
you got the video.
Yeah.
camera.
It's okay, I don't move in my
Yeah.
sleep. I just stay like this all the time.
Okay.
Thank you.
So the key there is just preventing insect bites, and that's about wearing long sleeves, long pants, using DEET or using off or whatever bug spray, and then staying indoors during peak hours, which is dawn and dusk.
Okay.
That's everybody knows that from the Jersey Shore. You don't want to have your picnic at dusk
Uh-huh.
because that's when the mosquitoes come out.
Yeah.
Biggest plates I could find. So you could have like a little bridge
Yeah.
of plates. And
That is great. Is
That'll be
is
fun.
what you said written down, or
Mhm.
just thoughts all in your head? Because
Oh, no,
we
no.
will show this to, well, of course, Jess Haggerty will see it, Christine Graff will see it, but also Dr. George wants
Oh,
a
sure.
briefing.
I can send her something.
That would be great,
Okay.
if you would.
Sure,
If you
'cause I
wouldn't
had this
mind
at home.
doing that, Sue, from you as a health professional, to
Okay,
say,
that's
Be
fine.
happy
you know,
to.
if I can brief you, she may wanna call you. Do you
Okay.
mind?
No, not at
Yeah,
all.
I'm just feeling like I would rather have that come directly from a health
Do that.
professional. So.
Yeah. Any other questions, if anything?
Yeah.
Are you sure?
Anybody else have
First, I'm
questions?
assuming you travel with a first aid kit with Band-Aids and antibiotic
Yeah.
ointments and.
Yeah.
Thank you
That's a
very
good
much.
idea.
Mm-hmm.
Yeah, we will do that, and we may
Even your
even
own
just,
little ones. I probably
Yeah.
have. How
They're
many
like
people?
99
there's 10.
There's 10 of you. I probably have 10 that we've used as a promotional item at a health
Oh,
fair.
that would be
I'd be
great.
happy to
Would
send
you?
them over.
Wonderful.
Thank you.
Yeah.
3.
Yeah, we should
And I
be
think they
videoing.
come with a little
I hope
Tylenol.
we're getting Sue rather than me. Thank you, Jen.
I'll be happy to send them over.
Sue, thank you
You're
so
welcome.
much.
If you
Yeah.
if you think of anything else, let me know. And again, that Travelers Health at Penn at Radnor, they're a great resource too.
Right, right. I mean, you could, and then we will, it doesn't really fit under health, it fits under finance, but it isn't inexpensive, some of these shops.
No,
Some of
they're
these
not.
shots and meds are not
Really
cheap.
expensive.
So that
Check
is
with your
something-
carriers if they're covered. They should be. Certainly, your tetanus booster should be covered by your carrier.
Yeah,
And hepatitis A, typhoid probably would not be.
no, if it's
And-
associated directly with travel, it won't, because
Right.
One's open.
unless you have a really, really good policy.
Picky, picky, picky.
The only other thing would be to, if you have that kind of relationship with your primary, a lot of folks travel with
This
a
one's open
course of
too.
antibiotic therapy
How do you know it's
just in case.
Yeah,
Just in case you
I
get
see.
strep
Right.
throat, just in case.
That's what I.
You
so
get
do you
diarrhea.
think we should request like amoxicillin just in case?
Yeah.
or
Just- okay.
Cipro, I know
Yes.
they gave me
Okay.
Cipro.
Just
For
to
what?
travel.
I'm sorry, what I missed
Just an antibiotic that you ask your primary, say, you know, I'm traveling to Guatemala. I don't want to get sick. I don't plan on it. But if I do, I would love to have a course of antibiotic therapy with me.
Mm-hmm. And again, they're naturally wary, you know, but, so if they don't, I know a trip I was on, still, it's much better if it's your antibiotic, because there are people who are allergic to certain
Mm-hmm.
ones, and you would
Mhm.
want to be sure that if you do get sick, that you have the right one.
Thank you.
Thank
You're
you.
welcome.
Thank you,
Sue,
Sue.
you were
Have
great.
fun.
Thank you so
Have
much.
a great
Is the
time.
flu shot still $25?
Yep.
Okay.
And we have plenty of.
Okay. So.
Some doctors give them out for free.
Mhm.
Yes.
Some doctors
That's what
give them
she
out
said,
for
but-
free.
And some, like the Minute Clinic at CVS in Rosemont, the new Minute Clinic, I think they just automatically bill your insurance. We don't third-party bill here. So you're welcome to submit for reimbursement.
I even went to Target and
Right.
they
Mhm.
gave me free since I didn't know.
Oh, yeah.
Yeah,
Yes,
I
they
did
have
too.
arrangements with some insurance carriers that they don't, they just contact your carrier right away.